Thank you so much for joining us today. We're excited to have you with us. And I'll get our slides started here. I know many of you may have seen the flyer. You might have gotten this flyer through your email, seen it as the invite on the Facebook page or website. We're excited to start a series of educational webinars so that even if you're a little cautious about getting out into group settings, we can still all get together in a virtual way and hopefully learn a few new things and get to know each other a little bit better. So today's presenters, I'm Dr. Susan DeBott, and I work for a company, a hearing aid technology company called Widex. I'm actually a trainer or clinical product specialist. So I'm here to share kind of some information on our hearing and wellness topic today. And joining me today from Naples Audiology are Christine Peacock, audiologist and owner, and Christy Hughes, audiologist with Naples Audiology and Hearing Center. We're going to kind of launch right in today, actually, and I want to give just Christine and Christy a minute if they want to say anything, introduce themselves.
Sure. Yes, we just want to welcome everybody. Thank you for coming today. I know this is a little different way to do, you know, a little seminar, but I think it's really creative and it's casual. You can grab your lunch and sit back, but I hope that you learned something today. Christy and I are here as a resource for you if you have any questions ever about just hearing loss, treatment for hearing loss, and we just hope that you enjoy today's seminar and feel comfortable asking any questions. And if you don't want to ask questions on the seminar, we will give you our contact information at the end of the seminar. But thanks for coming.
And maybe could you just tell us a little bit about Naples Audiology, how long you've been in practice there?
Yep. So Christy and I both have been audiologists for quite some time. I've been an audiologist for 19 years. Christy has been an audiologist for over 35 years. So we both have experience as audiologists. However, the business is still fairly new. We have been in practice for a little over 3 years. I actually purchased the practice from a gentleman who is an audiologist here in town who decided to retire. So he had a practice. So we took over the practice, renamed it, rebranded it, and his patient take care of his patients. So the practice has actually been here for a while, but Naples Audiology has been here for a little over 3 years. So far things are going great. We're growing very quickly. We think we have excellent patient care, and we believe our patients agree with that, and that is why things are growing so quickly for us.
Well, that's great. I know people do have choices when choosing hearing care providers, but your approach and the focus of your practice, as is shown by kind of branching out to do some new and innovative things in terms of online education. Yeah, we
just want people to know that hearing is important and taking care of your hearing is important, and that's why we are here, you know, to make sure everyone is healthy and being taken care of, whether it's with hearing devices, not with hearing devices. That's what we're here to help those people find out.
Very good. Well, let's go ahead and kind of jump into our topic today. The title of our presentation today is Hearing and Wellness. So we're going to walk through just a few different kind of topic areas to help kind of fill in some of the gaps of your knowledge and hopefully create some questions. And if you don't mind, if you do have a question, if you would type it into the chat. We have Ben Ditch joining us today too. He's kind of monitoring the chat for questions, and he'll kind of gather questions. We'll be stopping at different points to have some of those questions posed so that we can give you answers. So let's start by talking a little bit about hearing loss and how common hearing loss is. Many of you attending probably either have maybe the beginnings of hearing loss or have friends or family loved ones that are dealing with or coping with hearing loss. Certainly the thing to know is that if you're experiencing these things, you're not alone. Over 48 million Americans, or 20% of us, have some degree of measurable hearing loss. And as we get older, it's more likely, for a number of reasons, that we might have more noticeable hearing difficulties. So over 40% of us over the age of 65 do have more significant hearing loss. So how do you know if you have hearing loss? Well, certainly, typically one of the biggest complaints is that I can hear, but I can't understand. You know, your voice is loud enough, but I can't get a word that you're saying. And obviously that's even more noticeable when we're in noisy environments where there's lots of other people talking at the same time, or we're trying to hear a voice, you know, from a distance. So if you find that you're having to ask people to repeat, you know, we all kind of develop those little habits of saying what, or asking people to repeat, or doing the huh kind of thing. If that's becoming more noticeable, that's usually one of the first signs that your ears aren't picking up everything that, say, your brain needs to easily understand and have a conversation. Also, you know, even with normal hearing, we depend on seeing people talk and being able to do that facial expression and lip reading. So we all do that normally, but as our hearing may decrease, we may find ourselves depending more and more on being able to see the person to really easily understand them. So if you find that if someone starts talking to you and then turns away and you're lost at that point, that could be one of the signs that you have some early hearing loss. And of course, if you find the TV volume or radio volume kind of creeping upwards slowly, that's typically how we kind of make up for the lack of hearing information by increasing to decrease the difficulty of understanding when we're watching a TV program or listening to music on the radio. And then I do have a number of patients that often say that, gee, it just seems like everybody mumbles. Well, indeed, there are certain of those among us that maybe are soft talkers, or we don't enunciate as well as, say, others. But if you find that more and more people seem to be unclear and difficult to understand or are mumbling, that might be a sign that it's your ears rather than their speech that could be responsible for that difficulty. As we get older, it's natural for us to have more hearing difficulty. In fact, 2/3 of people at the age of 70 or older have hearing loss. And it can be due to a number of different factors. Maybe we've worked around noisy equipment or machinery, so there's been some loud sound exposure that has contributed. Sometimes we have other health kind of issues that will have concomitant effects on our hearing. So for those of us that live with some even mild hearing loss, it's important to know that studies have shown that the longer you live with untreated hearing loss, even beginning at the very mild stages, the more impact it has on our brain's ability to function. In fact, there's about a 7-year decline in cognitive function, that is in kind of short-term memory and processing speeds, even with a very mild degree of hearing loss. So important to recognize those early signs of hearing loss and do something about it in order to preserve how quick and how easily your brain functions. We know also that as we get older, and even with mild hearing loss, it does increase our risk for the cognitive impairment by about 24%. In addition to that, hearing loss also tends to lead to us being more isolated. You know, I mean, we've all been in the situation at a noisy party, and if we're having difficulty hearing, you know how tiring it is to be in that situation for extended periods of time. And over time, that leads to us kind of avoiding those situations. So as time goes by, we may find that we're doing less and less social kind of activities. We're isolating ourselves. And this isolation in and of itself, the lack of stimulation and social stimulation, conversational stimulation, also has a negative impact on how well our brain functions. So the longer we live with hearing loss, and that isolation will have an effect on our cognitive capabilities. Now, most people ask the question first, it's most noticeable that when I go into a restaurant, I just can't understand a word. Why can't I hear, even in mild background noise? Well, we know as we get older and our brain ages, even if we have still pretty good hearing, that it's going to require for us to understand that the conversation be louder than the background noise. And this is true by about 3 to 5 dB for older listeners as compared to younger listeners. That conversation needs to be at least about 3 to 5 dB louder for that same ease of listening in background noise situations. As we get older, your brain needs more information to accurately comprehend the message. And of course, that's again true in background noise. And we know that even mild cognitive difficulties become more noticeable, more pronounced when we're listening in challenging kinds of conditions, like being in a restaurant with lots of people all talking at the same time, and we're trying to hear that one voice against the background of many. So the brain typically does a pretty good job. It identifies and differentiates between speech or conversation and background sounds. Even when the background sound is other people talking, our brain typically does a pretty good job of pulling out that one voice that we want to hear, but it does need a complete sound picture to understand with ease. If our hearing is declining a bit, the brain up to a point can do a pretty good job at kind of filling in the missing information, at least by kind of knowing what the topic of the conversation is, following the conversation around the table. But it needs to be able to understand the sounds that it is receiving. Sometimes not only do we have a decrease in loudness as part of a hearing problem, but additionally, the clarity of speech and of sounds may also be affected. So even in a quiet place, there may be some natural distortion in the hearing mechanism in our ears that also interfere with the ease of listening. The brain does a good job in most cases of filtering out the unwanted sound and focusing on the wanted sound. But all of that activity in the brain takes energy and focus and concentration. We call it the ability for the brain to kind of do executive decision-making and listening, deciding what's important to focus on, what's not important to focus on. As our hearing declines, the ability for the brain to do that becomes more and more challenged, and we call that kind of cognitive loading. So I want to give you just a little example. We're going to do a little exercise here, so I want everybody to participate. This is quick and easy, but first what I want you to do is to say the colors of the dots that I put up on the screen next. Now the idea here is to say it out loud and to say the colors of the dots as quickly as you can, kind of going from left to right. So everybody ready? Here we go. All right, and if I could hear all of you, I'm sure that was quick and easy. You out loud read red, blue, green, yellow. So that was pretty easy, right? So we're going to try that same thing again, a little bit different task this time. I want you to say the colors in which the words are printed. And again, say them out loud for us as quickly as you can from left to right. Here we go. Now, typically, people still do pretty good at this point. Your brain is actually being tasked to make those executive decisions, right? So the first thing your brain wants to do is to read the word hard, but your brain has to stop and think, oh, that's not what she wanted me to do. She wants me to say the color in which the word hard is printed. So you had to kind of go through 2 decision-making processes. It takes a little bit more time. So you might have noticed that you weren't quite as quick to say the colors green, red, white, and blue, right? So let's try one more. Again, same instructions. Say the colors in which the words are printed out loud, quickly as you can, from left to right. Here we go. So this is where people tend to find it slows down a little bit as they get ready, because now not only do I want to read the word red, but I want to say the word red because that's a color, but I have to remember, no, I've got to say the color in which the word is printed. And it's really hard to say the word green when we're looking at the color green when we're looking at the word red. So if you found that it took you just a little bit longer to complete this task, that's an idea of what cognitive loading can do. So when we have hearing loss, that slight and subtle slowdown in function is what makes it difficult as we're trying to follow a flowing conversation, and maybe a conversation amongst many people. Those subtle little slowdowns in brain processing, that cognitive loading, is what makes it difficult to keep up with the conversation. It's what makes it tiring to be actively trying to do that for extended periods of time. So if you found that when you're in a challenging listening situation, that after 15 or 20 minutes, you just have to kind of sit back and tune out because it's taxing, it's tiring, that's the effect of cognitive loading. So with different degrees of hearing loss, the amount of cognitive loading is more and more noticeable. We're going to take a quick pause just to see if there are any questions from the audience. And Ben will chime in and let us know if there are any questions that we want to address.
No questions as of yet, Susan.
Okay, very good. And I want to invite both Christine and Christy to offer any kind of comments with the patients that they see, the kind of complaints, patients first noticing hearing loss, if there's anything that they want to comment on before we continue. If not, if we're all good, all right.
I can say something real quick.
Yeah, sure.
I mean, I think one of the things I've even recently with my patients have heard from them is not, I mean, obviously cognition is extremely important, but especially with this pandemic, a lot of people, you know, are not as social as they're used to being. And obviously we know that being social ties in with cognition in a lot of ways, kind of like if you don't use it, you lose it type, you know, scenario. So a lot of my patients have been more homebound, so they're not actively using their, you know, their cognition as much as they normally do. So that can really tie into hearing because they're not hearing things and therefore they're not stimulating that cognition. So I really think the two are going to go hand in hand. Also just personal relationships and how much those can be impacted if somebody isn't hearing, you know, a companion at home or a grandchild that now we're having to talk to on the phone more than usual.
Definitely.
So those are just some things that I'm recently hearing, especially with what's been going on.
Yeah, and I'm glad you brought that up because even with very mild loss, or even for me with pretty normal hearing, now we're in situations where we're trying to hear through masks.
Exactly.
And that definitely makes it more taxing. I've been in many situations at the grocery store where, you know, I'm finding that I'm having to ask people to repeat. So I know for those individuals, even with mild hearing loss, and certainly those, even with hearing aids, it's a challenge in today's environments. And all of those things add to the amount of effort that we have to apply to enjoy conversation as easily as we once did.
Yep.
Yeah, thank you. I'm glad you kind of brought that up because that is something that many more people are experiencing. Again, even with near normal or mild hearing loss. So if there aren't any other questions, let's go ahead and continue. And please, again, feel free if something comes up that you do find a question, even if it's related to the previous topic, just type it into the chat. We'll make sure we get around to everybody's questions today. So now we'll kind of move into looking at, are there different types of hearing loss, and how do we know? How do we measure hearing capabilities? And first, just to kind of talk a little bit about different types of hearing loss, there are two main different types. One that we call a conductive loss, and this occurs in the ear canal or middle ear. It's kind of how is sound conducted from the outside down that ear canal to the eardrum, and then into the inner ear, and then of course into the brain. And there are some actual mechanical mechanisms that can have some disruption in how well they move that sound vibration from outer ear to inner ear. The conductive loss represents a fairly small percentage of overall hearing loss that we see. And it can be related to something that's actually quite easy to remedy. Sometimes it's as simple as some wax buildup in the ear so the sound waves can't reach the eardrum. We get the wax out of the way and everything kind of returns to more normal hearing sensitivity. There are times where there can be injuries to the eardrum. We used to see this when people would clean their ears vigorously with a Q-tip. It's possible to actually perforate the eardrum. There are times where maybe I've had a car accident or maybe some sort of kind of head trauma, and the little bones in the middle ear, the hammer, anvil, and stirrup can actually be broken, or what we call disarticulated, so they're not working efficiently through that little chain of bones. Sound vibration is not going to be able to efficiently reach the inner ear. So these kind of mechanical conductive types of hearing loss, quite often we can test for them to identify them, and we can refer for medical treatment, because sometimes with medical or surgical treatment, they can be restored. Now, the more prevalent type of hearing loss that we see is called sensory neural, or what people often hear is called nerve loss or nerve deafness. So we know the eardrum, the three little bones in the middle ear, everything there is working fine. The sound is moving through, sound waves and vibration is moving through. But the portion of our ear that turns that sound wave mechanical motion into a nerve impulse is what we call the inner ear, the cochlea. And this is about 95% of the hearing loss that we see. It can be caused by kind of natural aging processes within the ear that can be related to metabolism, cardiovascular, the blood supply to the inner ear. It can be overdriven and damaged by excessive loud sound, noise exposure. And sometimes we may inherit a tendency, there may be a genetic kind of background that leads us to develop hearing loss, either from a very early age or sometimes more gradually and later in life. So sensory neural hearing loss is the most common kind of loss that we see. When we talk about sensory neural, we're actually talking about all of these little nerve fibers in the inner ear that are responsible for turning the vibration of sound into a nerve impulse. And because of many of these aging, noise exposure, certain health issues, the nerve fibers become damaged, and once they're gone, they are gone. They don't regrow. Now, typically this is actually an electron microscope view inside a human inner ear, inside the cochlea. Now, unfortunately, we can't see this in a live person. So we have other ways of finding out how well these nerve fibers are working, and if there are areas of sound that the nerve fibers are missing and unable to respond. So how do we do that? We do some testing in an audiological evaluation that really evaluates all of these areas from the outer ear through those middle ear structures, the inner ear, the cochlea, and of course the nerve that leads into the brain, because we hear with our ears, but we understand with the auditory cortex in our brain. So we have to have good function across that whole pathway. The way that we test this is by performing what we call an audiogram, a hearing test, that measures your ability to hear sounds of various pitches and loudness. We represent the results of your hearing test on a graph, as you see here. And across the top of the graph, we talk about pitch of sound, going from left to right, from bass tones to high-pitched treble tones. Along the vertical side of the graph is loudness of sound. So we're looking at how loud does a sound need to be for you just to be able to detect it. And obviously, we're hoping that you can detect sounds of all pitches at very soft levels, so up at the top portion of that graph. When we do the hearing test, we're also paying attention to where speech sounds fall in this same kind of pitch and loudness spectrum. Consonant sounds are softer and more high pitch in nature. Vowel sounds, which carry more vocal energy, are louder and more bass tone or low frequency in nature. Now, can you guess, of the two, vowels and consonants, which are the most important to hear for easy understanding? And if you said consonants, you were right. Consonants carry the bulk of the information. Vowel sounds carry the volume, but consonants carry the information. So our hearing for all of those consonant sound is very important. There are other sounds as well as speech that we do want to be able to hear, some of them being very soft, very subtle, very high frequency, others being louder, but we need to be able to hear them just to be aware of what's coming in around in our environment for safety and awareness. When we do the hearing test, though, we're paying special attention for the speech sounds. And this is an example of a very common kind of configuration of hearing loss. It's what we call a high-pitched hearing loss. So the red circles represent the right ear, and blue X's represent how I'm hearing in my left ear as we test these different pitches of sound. So in this case, we can see the bass tones at the left side of the graph. I'm hearing at the very top part of the graph. So I'm in essentially still 0 to 20 is still considered normal. But as the pitch gets higher, you can see I have to make that sound a little bit louder and a little bit louder as we go. And the person with this high-pitched hearing loss is typically the one that's saying, I can hear, but I can't understand. They're missing maybe about half of the consonant sounds. So the voice is audible, but the specific words that are being said is not so easy to make out. So again, this is a very common, the beginning stages of kind of this high frequency hearing loss, and what we begin to notice as that struggle to understand conversationally. As time goes by, we may see that more of the mid frequencies right in the middle, and now in this case, almost all of the consonants would be very difficult to distinguish. The voice volume would still be there. This would be the individual that needs to be looking at you, needs to be close to you in proximity for conversation to be easy. This moderate degree of hearing loss, some of the voice volume is beginning to be affected too. So being close to the speaker and face-to-face makes conversation more readily accessible. And then we may have people that may be more in this severe hearing loss range. Now, not only are the consonants difficult to access, but even the voice volume. This is the person that has to be seated right next to you, face-to-face for sure, and you may have to speak a little bit more loudly for them to have that conversation. All of these degrees, from even mild to moderate to more severe, are hearing losses that we fit with amplification, with the idea of restoring that ability to hear these sounds, the vowels and the consonants, in a more normal fashion. So in many cases, once we do the hearing test, and I would ask, if you have had a hearing test before, have you had a hearing test in the last, couple of years? The AMA directs that we should have at least a baseline audio by age 50. And if hearing loss is identified, we should have our hearing retested every couple of years at least. After the age of 65, the recommendation is to have your hearing tested annually, just like you would have your vision tested as well. Now, there are some other things that we test for, and maybe I'll ask Christine or Christy to kind of give a little bit of a background on how you approach the hearing test in your office.
So we do basically what you just showed. We do what's called air conduction testing. So basically just seeing how soft somebody can hear at all the different pitches. We also do bone conduction testing, which again is going to tell us whether that hearing loss is associated with more of the middle ear space versus that cochlea, which is in the inner ear space.
Mm-hmm.
And that will give us the knowledge as to whether or not the patient needs to be referred to maybe a medical doctor versus maybe they need, more like a hearing device because the hearing loss can't be treated medically. We also do speech testing. So we not only want to know how somebody, how they hear volume, but we want to know what they do with that volume and how they understand words. Unfortunately, some people can have not that bad of hearing volume wise, but they may not do as well with the words, and that gives us a lot of information. So the word test, in our opinion, is just as important as the volume test. So that's the main testing that we're going to do. We do have some options to do speech testing when being presented with some background noise, but that's pretty much the full picture of what we do on a typical evaluation.
Okay. Ben, any questions from the audience?
You guys are actually doing a great job because you already answered a couple of them as far as how often should somebody have a hearing test, but there is one. Are there any types of hearing losses that can't be helped or treated?
I mean, there is such thing as hearing loss that we here at Naples Audiology would not always be able to treat. We typically treat hearing loss with hearing aids here at our office. So the patient does have to have some form of hearing in order to be a candidate for a hearing aid. If we feel that their hearing loss is severe enough and we would not be able to help them here, we would then consider sending them for a different type of evaluation. Some people are candidates for something we call a cochlear implant. And again, that's something that we only would refer out if we really don't think a hearing aid is something that would help them.
Good. And then the other question was, how long should a hearing test take?
Hearing testing only takes maybe 15 to 20 minutes for the test itself. And then of course we would go over the results. So the whole consultation can take anywhere between 30 minutes and an hour.
Perfect. That's all the questions for now.
Good questions.
And I would just kind of end by saying that if you haven't had a hearing test, at least not in the last few years, getting that baseline hearing test is important, even if you don't have any problems now, because
Exactly.
if a couple of years down the road, something changes with your hearing, having a baseline that we can refer back to is so helpful in figuring out why there may be some changes going on, how much of a change does that represent. So having something to compare back to. So better to have that initial baseline, even if you're not having any difficulty, but just for the purpose of figuring out kind of where you stand today.
Right. No harm getting that done.
Not at all. So maybe you've come in for the baseline audio. You're experiencing a little bit of difficulty, and with the results of that hearing test, maybe we do find that there is some hearing loss in that consonant range. The question then is like, okay, so what? Well, what do I do now? And that's when we begin to talk about maybe some sort of technology that can help to compensate for that decreased hearing, restore that ability to hear those sounds to a more natural level. And if we look at the way that technology has changed in the hearing instrument world, the hearing technology world, it's it's been phenomenal. And in fact, if we look back even like 10 or 15 years ago, where we might have had like the VHS for watching videos, an old standard kind of phone. We might have listened to cassette tapes on our big boom box. All of that technology now, including video technology, fits into the palm of your hand. And so it is amazing to look at the ability for our smartphones to be so much a part of our connection to the hearing world these days. And our smartphones can now connect and work in tandem with hearing instruments. The benefit of the smartphone is that we can use apps that can give control. So now, as those of us wearing those hearing instruments, we can have more control at our fingertips than ever to hear sound the way we want to hear it in the moment that we're in. Also, we can stream sound from those phones into hearing aids as well. So that can make even just conversation on the phone so much easier. For some of you, you may already be wearing hearing instruments. And so the question is, well, you know, when and why would I need to consider new hearing aids? Well, certainly if you feel like your hearing aids are a bit antiquated, maybe you've had them for 5 years or more. Maybe you see your friends using these apps with their new hearing instruments and you kind of wonder what that's all about. So if you find that you are struggling to hear, even with your hearing aids, you're still having to work hard to kind of overcome those issues, struggling to hear family members in those social situations. You find that you take your hearing aids out when you're in a noisy place because it's more comfortable to hear with them out, even though you struggle to hear the conversation, say in that restaurant. If you find that just recently your hearing seems to have changed, or maybe the hearing aid isn't working the way it did even, you know, a few weeks ago, that's a good time to get evaluated and see what's going on, whether it is your hearing or the function of the hearing aid. Also, if you find that you have to take your hearing aids out to use the phone, you really no longer need to do that. And there's a variety of solutions for both home phone and with our smartphones as well that can make conversation on the phone so much easier. After a certain amount of time, you may find, as I mentioned, if your hearing aids are maybe 3 or 4 or 5 years old, that you find with the wear and tear on wearing a hearing aid every day, you may be in the situation where you're having to do some repairs. And if you're finding that kind of every year you're spending a certain amount of money on repairs, it may be better spent by putting that money and investing into new technology than spending money on keeping old technology going. And if you find that you're not getting any benefit from your current hearing aid, so you've kind of stopped wearing them, the last thing we want to see is a hearing aid in the dresser drawer. We call them ITDs, in the drawer hearing aids. You know, you invest money in that technology. We want to make sure you're getting benefit out of them. We don't want that investment sitting unused in a dresser drawer because they're not helping. So if you find yourself in any of those situations, it may be time to get reevaluated and kind of see what some of the new technology solutions could mean to improving your benefit from your hearing technology. I'll talk just briefly for a minute about Widex as a hearing aid technology company. And the latest product that we have on the market is called the Widex Moment. And truly it is a natural and comfortable sound that doesn't sound like you're wearing a hearing aid anymore. So I would encourage you, if you find that your current hearing aids, you know, you find that you can do okay with them, but there's you're always aware that you're wearing a hearing aid, it's worth coming in and actually taking a listen to the new Widex Moment. It's available in a variety of what we call receiver in the canal styles, those tiny little over-the-ear instruments with the almost invisible wire that tucks down to the little speaker in your ear. Those are so comfortable and easy to get used to. You don't even know you have them on. And of course, there's still, for those that prefer for something to be all in the ear, there's a variety of styles of in the ear moment as well. The idea behind Widex's approach to amplification, to restoring normal hearing, is to adapt to the situation that you're in. In other words, we want the hearing aids to do all of the hard work so that you can just go throughout your day and not have to think about your ears or your hearing aids. And technology these days is highly refined to be able to recognize the kind of situation that you're in, whether you're going from being in the house quiet in the morning and going outside, taking a walk, maybe getting in the car, going to the grocery store, going to a doctor's appointment, maybe meeting someone at the coffee shop for coffee. All of those different sound environments require different things from your hearing. And we want the hearing technology to be able to recognize the differences, recognize conversation against those different backgrounds, and again, allow you to kind of go throughout your day without having to think about your hearing aids or experiencing hearing difficulty. So we have technology now that is very sophisticated and being able to be very automatic and what we call transparent, which means that it's doing all of that work in the background. You're not aware. You just know that you're hearing and you've got access to the sounds that you need and want to hear. When we are able to deliver good, clean sound, and Widex is known for pure sound, it's actually one of the signal processing strategies, we tend to get responses from people wearing those hearing aids, particularly for the first time, that it's kind of a natural, kind of invisible kind of sound. They don't know that they're wearing the hearing aid. If they've worn hearing aids before, they tell us that their own voice sounds better. It's clearer, there's less noise, it's a more pleasant, I have just kind of better understanding without having to think about it. So the approach that Widex uses delivers that kind of natural hearing and great sound quality. In addition to that, for those of you that would like to have a little bit of control on how you're hearing the world around you through the hearing aids, we have an app that can be used on an Apple product or for Android platforms. And it's a very simple and easy to use app that lets you choose different programs that your audiologist may design specifically for your use. And then it lets you modify how you're hearing with those programs too. So with the touch of one finger, you can easily kind of dial in better hearing, the hearing that you prefer to have for that specific situation that you're in. Widex family of hearing aids also offer a variety of accessories because there may be certain situations where you want to be able to hear from a distance. So there's kind of remote microphone technology. There are special phones that make listening with the hearing aid from your landline phone so much easier. Maybe you don't have a smartphone, but you've got a landline phone at home and you'd like to be able to use that phone with ease to have conversation with friends and family. There's TV accessories. There's other types of remote control accessories. So a whole variety of things that can help for certain situational listening needs over and above use of the hearing aid if needed. I want to quickly mention just a little bit about tinnitus or tinnitus. This is a very common thing for those with even mild amounts of hearing loss. About 90% of the people who have some ringing or buzzing noises in their ears, when we do their baseline audio, we find that they do have some hearing loss related. And so just as a basic definition, what is tinnitus or tinnitus? By the way, both ways, both pronunciations are correct. It's really any kind of sound or noise, sensation of sound that you have that is not actually occurring in the environment around you. So its origin is from within your ear or within your own head. And it may happen in one ear, you may hear it in both ears. Some people even describe that it sounds just kind of like from the middle of their head. And sometimes they'll describe it as a buzzing noise, a sizzling or a hissing noise, a true kind of tone or ringing sound. Others describe more kind of roaring or deeper pitched kinds of sounds. So all of those come under this category of tinnitus. Now, it can have a negative impact. It can keep you from being able to fall asleep readily at night. Some people then end up taking maybe some sleeping pills and stuff to kind of calm them down. So it can then lead to, depending on some of those medications, it can even interfere with your ability to concentrate or participate in conversation in certain cases. And of course, that can lead to some frustration and anxiety and depression. That again can kind of lead us to avoid certain situations and isolate ourselves more. Some people even report that it's kind of leads to strain and stress, headaches, tight muscles, certainly annoyance and irritation, and sometimes real frustration with having to manage and cope with that sound in your ears. Again, 50 million Americans report having tinnitus, either described as any kind of ringing sound, buzzing sound in the ears. There are a variety of different causes, and this is part of what we look at when you come in for an evaluation. We evaluate the tinnitus and then take questionnaires and medical histories, health histories, hearing histories to try to piece together the puzzle that might be leading to you experiencing the tinnitus. The one thing we know is that there is no one single cure for all people when it comes to tinnitus, but there are actually a variety of approaches to helping manage it. So there is hope. And Widex actually has built into all of its hearing aids a tinnitus management program called Zen. So Zen uses music as a form of kind of sound therapy. So just imagine if you're in a quiet room, typically the ringing in your ear is the only thing that you can hear. Your brain then focuses on that and it becomes even more annoying. Using sound therapy and this specific type of music allows us to kind of passively listen to the music. So our brain is now being kind of distracted. The tinnitus is there, but not as noticeable. And the music is specifically designed to relax you, to kind of calm down that annoyance level. And as our brain then learns to not pay attention to the tinnitus, but to get the benefits from the sound therapy, the relaxing kind of tonal music, our attention and focus on the tinnitus then diminishes. So this is an FDA cleared device for tinnitus treatment, and we have lots of studies that show that it's effective, and it's available in all hearing aids. It's a very specialized approach, one of the only companies that uses music as this form of sound therapy. And we do have results showing that it does provide relaxation, can improve concentration, and lower the annoyance level of the tinnitus. As I mentioned, it's available in all levels and all styles of Widex technology. So let me go ahead and wrap up, and then we'll take any other questions or any other comments from Christine and Christy. The takeaways that I hope you got from today's seminar is that there are a lot of good reasons to find out about your hearing, and if you have some hearing difficulty, to take action and do something about it sooner rather than later. Obviously, improved hearing for your whole environment of sound. Remember, hearing is a 24/7 sense. We're even hearing actively when we're asleep at night. Those of us that have been awoken by a sound know that our brain is always kind of monitoring what's going on. And it relates us to our whole environment. So there are reasons for both safety and awareness of our sound environment that hearing well is important too. Obviously, improving the ease of conversation and that connection with loved ones, staying engaged in those social activities is going to be good for us mentally as well as our physical health. And those abilities to hear conversations, even in challenging listening environments and over the phone, are important to keeping us active, keeping us learning, and staying independent, not having to depend on others to hear on the phone or in restaurant types of situations. and reducing all of this stress, reducing that cognitive loading on your brain by lessening the listening effort. In the end, that's going to keep your brain working better, keep it fit, working faster. And that's going to be important at any age, keeping that brain fitness intact. So there are basically 3 steps. I always try to drill everything down into what are the 2 or 3 things that I need to know to do. And we can check off kind of step number 1. Personal education, learning all that you can about hearing loss in general and what the available solutions might be. That's important. And actually, by participating in our seminar today, hopefully you've increased your understanding about the importance of good hearing to our overall health and mental well-being. The second step is, if you do have some difficulty or aren't sure, if you haven't had your hearing tested in a long time, find a knowledgeable professional to work with. And the professionals that you've met today, Christine and Christy from Naples Audiology and Hearing Center, are at the top of their field, lots of years of experience. So understanding what the technology, state-of-art technology has to offer, and helping find the right solutions for your particular needs, that's very, very important. So I'm hoping that you'll also take advantage of the ability to schedule an appointment for that baseline audio, or to have, if you've had your hearing tested in the last couple of years but aren't sure if you're hearing quite the same, take advantage of the opportunity to have that hearing evaluation and consultation, and maybe even listen to new technology. Take a listen to the Widex Moment hearing instruments. So you can, of course, contact either through the chat. You can reach out if you have interest in scheduling an appointment. We can do that right through the chat today. You'll also have the opportunity to call in to 239-434-2434, or you can go to the website. You can schedule through the website at napleshearingcenter.com. So I'd like to kind of turn it over back to Christine to kind of wrap up, and anything else, any other questions that we have come in, we're available now for a while.
I mean, I thought that was incredibly informative and so well done. You really hit the nail on the head, Susan. Thank you so much.
Yeah.
And thanks to Ben and Widex. I just feel like that was extremely informative. So I don't really have anything to add because you were so thorough. So it was very well done. I just want to encourage anyone who just has any questions or wants to come in for that hearing evaluation, please don't hesitate to contact us. We are here to help and happy to do so.
Great. And I know some of the attendees today actually are clients that have been into your office that participated today, but there are a few who are new to your office. So maybe if you could give just a description of where you're located.
Sure, yes. So we are just south of Coastland Mall on Route 41. So if you are familiar with going towards downtown 5th Avenue, we are in that direction. So just south of Golden Gate on 41. Right next to our building, there is an Einstein Bagel. So if you ever go there for your morning coffee or bagel, we practically share a parking lot with them. We are a 3-story office building and we are on the 1st floor. So we are 1250 Tamiami Trail North and we are in Suite 110.
Very good. And Ben, just to wrap up, any other questions from the group that we want to address?
No other questions. I thought you were very thorough as always. So, and as a hearing impaired person myself, and knowing the importance of actually having that technology or having that test, if you've never had one, definitely go in. They make it pretty easy. And it's always good to know. So no, I think you were very thorough. No other questions.
Very good. Well, thank you all for joining us today. I hope you'll take an opportunity and reach out to chat with Christine and Christy. Megan will maybe be the one that you'll talk to first, answering the phone as well. And they're there to help you. And I hope you'll take advantage of that opportunity. So thanks for joining us today, and we hope to see you soon.
Thank you.
Thanks everyone for joining.
Bye now.